Today we have Dr. Kevin Wisniewski, who is our second year family medicine resident, and Min, who is our pharmacy resident. I'm just talking so fast to make sure I'm doing that correctly. So today we're going to talk about hypertension, fancy word is saying high blood pressure. It's one of those things that it's kind of silent. So a lot of us might be walking around if we don't have regular medical checkups and not know that we have it. But if it's gone untreated for too long, there can be a lot of different problems related to that. So today, these two are going to tag team, talk about what's normal blood pressure, how our blood pressure should be taken, what are some of the things that cause hypertension or high blood pressure, and what can we do about it medication wise and otherwise to kind of keep it under control so that we're living stable, healthy lives. So I'll turn it over to two of them and we'll stick around in case you have any personal questions.
Yeah, so like Tony said, hypertension is high blood pressure. It actually ends up being one of the biggest risk factors that you can have for a stroke. So it really increases your risk of having a stroke, even above smoking cigarettes. So it's a pretty big deal. We diagnose it usually when that top number, we call it systolic, this one right here, when that's greater than 130, and the bottom one is greater than 80. Our like just right is 120/80. That's where we would see we're perfectly happy with where you're at. There are a couple of different causes. It's one of those diseases where it's multifactorial. It's not just a simple yes or no. Some of these things you can change, some of them you can't. So like aging, genetics, you can't really change much at all. You know, your age is your age, your genes are your genes. Overweight, obesity, you can change a little bit. You know, some people just have a bigger body and that's how it's going to be. But a lot of the changes that people make in their life to treat obesity, like exercise, changing their diet, also will improve blood pressure, which brings us to an unhealthy diet and also not exercising enough. You know, having a healthier, well-balanced diet is going to reduce your risk. Exercising more will reduce your risk as well. The diabetes and lung disease, those are a little tricky because for the most part, once you have a lung disease or diabetes, you have them, but you can also treat them and make them better. And by improving those diseases, you can also improve or prevent hypertension as well. So like I had mentioned earlier, just simply looking at like the blood pressure reading, either on an automatic cuff you get or on your after visit summary when you see your doctor, the top one's going to be your 130. And that number represents how much pressure is in your blood vessels when your heart is squeezing. And then that bottom one is how much pressure is in your blood vessels when your heart starts to relax, stop squeezing. Guess we're not going to beach 2 on there. Yeah. Okay, it worked for her. I hit the arrow twice. It's probably gonna flick through to the end in a couple of seconds now. So then reading blood pressure, one of the biggest issues with hypertension is that we don't really read them properly at home. We don't read them properly at like senior center. We don't read them properly often, even in the doctor's office. So the ideal way to measure your blood pressure is, first of all, you don't want to smoke, have caffeine, exercise, you know, do things that are gonna get you excited 30 minutes before you're taking a blood pressure. You want to be relatively quiet and calm. You also want it to be comfortable. You don't want it to be too hot or too cold because both of those will affect your blood pressure. One, you're shivering, one, you're sweating. So, you know, pretty uncomfortable. And then you want to be resting, actually, just kind of sitting still calmly for about best is 5 minutes, but 3 minutes is sufficient. And then you don't want to be talking while the movement is, no, don't talk or move while they're reading it. Talking and moving can also increase that blood pressure and give us a false high. And then that's actually just about how you should be seated. You should keep that blood pressure cuff right about the level of your heart. And if you're using a wrist one, that would be the same. You'd want to hold it kind of straight ahead so they're at about the same level. Yeah, it's pretty important to measure your blood pressure routinely, especially if you are somebody who has hypertension. When you measure it at home and bring it into our office, it does help us, at least from my end, it helps me make decisions about your medication. You know, if you're ranging lower at home and then only when you come in, you bump up high, then maybe it's just that you're seeing me.
Stress.
Yep. You know, if you do take medication for blood pressure, you should be measuring it at least once a day. We wanna make sure that that's working or that it's not working too much because we don't wanna throw you into the low end because that's just as dangerous. And again, like I said, you can record them, and if you do have a home machine that you've never brought into your doctor's office before, you should bring that in so we can make sure it's accurate with our readings. Cause we don't wanna be, yeah, like I said, we don't want to be treating the wrong thing. On that note, we'll have Min talk a little bit about our treatments here.
So, we talked about what high blood pressure, hypertension is. Now we're gonna talk about how to treat it. So there's, in the big picture, two ways to treat it. First approach is to do lifestyle modifications. So it's gonna be like the diet, exercising. And then the second one's medication. But starting with the first one, lifestyle, a little more detail into eating healthy. Sodium is kind of the key that we want to limit. Because the higher the sodium you take in, the higher the blood pressure is gonna be. So our cutoff, based on the guideline recommendations, the number is 1,500 milligram. So we wanna consume less than that. Roughly, it's around 0.6 of a teaspoon. And that's gonna be really little. But you know how a teaspoon is, right? Really small. So a little more than a half is where you wanna limit that, so 0.6, 60%. And then you wanna also increase protein intake. Protein is just generally really good. It helps blood sugar also level out. And you get that blood pressure controlled as well, and also helps with preventing your muscle loss over time. So trying to take in a lot of protein and also vegetables. Vegetables, especially high in fiber, like celery, oats, and whole grains. Those are the ones that you want to increase consumption in. And then exercising, of course, as we all know. I like to give a goal, just so you have, you know, that target in mind. You want to aim for 2 to 3 hours of workout per week. And at least 30 minutes per day is the recommendation. And overall, just try to stay active. You know, don't try to be stagnant. Don't sit too long. Try to walk around the hallway and, you know, up and down the stairs if you're able to. And so stay active. And then sleeping also helps decrease blood pressure. Lack of sleep is actually going to raise your blood pressure. So the goal again is at least 7 hours per day is what we want to aim for. And of course, trying to avoid alcohol and smoking. If you do smoke, then we want to try to stop smoking, and we never want to start. And then moving on to medication. So if we tried all of that lifestyle with the diet, exercising, and sleeping, and your blood pressure is still high, then we want to try to look for medication. So I've listed a couple of the examples of the commonly used medications that we see. Some examples are lisinopril, Prevnar, losartan, amlodipine. The brand name is called Norvasc, hydrochlorothiazide, and spironolactone. Those are some of the common examples. And so a couple questions we get from elderlies and patients is how long does it take to get the medication effective and going in my system? So in a general sense, when you first take the blood pressure medication, in a couple hours, you will see some effect, but not the full effect. So it takes a couple weeks to a month for the full effect to show. And consistency and adherence, being adherent to it, whether it be twice a day or once a day, depends on the medication, the directions to it. But just making sure you get the daily medication in is important once you're put on the medication. Because if you miss doses, then it's just not going to be as effective. So those are the key points that we always try to tell our patients. And then a couple side effects of the medications for used for hypertension, high blood pressure, is of course, as Dr. Wisniewski previously said, going on the opposite side of being too low. That's one of the side effects that we see. It's also called orthostatic hypotension, is a type of those, low blood pressure readings, is when you stand up and you get dizzy and you get a sudden drop of blood pressure. That's a common side effect of the blood pressure meds. In that case, try to stand up really slowly, try to grab a hold of a chair or the wall, just making sure you don't fall is the biggest things that we put emphasis on. Because when you fall and break your bone, then it's really, it's bad. It goes downhill from there. So we want you to stay safe while on medication. So especially towards the beginning where your body's adjusting to the medication is where you want to pay attention to your body and take everything slow and safely. And then, as I said, feeling dizzy, lightheadedness, those are kind of the common expected side effects. Nausea and vomiting is kind of common with all the medications. So just looking out for your body and monitoring for those side effects. Feeling tired is also one of them. And then potassium level I put there because lab work, the blood work is one of the things that you want to be regularly done. If you go and see the doctor, you want to get the regular blood work going just to make sure that you're in goal. Because one of the medications or some of the medications could actually increase potassium levels. So just making sure you're at goal and your blood work is not off. So those are the things that we try to tell the patients to come in and see the doctors and see us regularly, and also try to monitor your body and making sure everything's good.
So the potassium level is due to the medicine that would be.
Some of the medications, I put an example there, spironolactone, lisinopril, losartan are one of the medications that could increase potassium, but not all blood pressure meds are going to do that.
Does it do that on everybody who takes them or just some?
It's not a 10 out of 10, you will.
I've taken the Cinepro for a long.
Mhm.
It's like, and in Iowa, Allen Hospital in Waterloo used to have a walk-in clinic. You could pay $20 and get, I think, 20 to 23 over the years. And they did like tests that the doctor couldn't do unless you had symptoms. And potassium level was normal. I'm
Okay.
not sure that it's checked now. I've only been in
Mhm.
Ohio 2 years, and they stopped the walk-in clinics with the COVID shutdown.
Yeah.
They still did it if you came in, but it kept up with the price. But no, I was just curious if it didn't have a problem for a long time, more than a decade.
Mhm.
Is it likely to start a problem? And if I don't have the potassium check?
So that is, it's not a gray, it's like not a white.
I understand, I said likely.
So it could show in some patients, it could be more so in the beginning, it could show in a couple of years. But another thing to keep in mind is other medications could decrease potassium too. And so there's, different factors that you want to keep in mind. It's not just the blood pressure med.
Yeah.
And it could show in the patient and not show as well. But these are just the things that we keep in mind when starting the patient.
Yeah, the other thing I would add is that does change depending on what's going on. So like if you come into the hospital and you have an infection in your blood, then that actually might cause that potassium to go up because of your lisinopril. Just because your body has changed on the inside, so we have to, it's situational. Right here, probably it's a lower risk, but if you break a bone, get sick, end up in the hospital, then it's a little bit higher risk, but that's why we check it every day while you're in the hospital as well.
And I was thinking about the possible causes, right? I can't change genetics, but hey, I could change aging by dying.
Well, yeah. technically.
My blood pressure wouldn't be too.
No, we're not.
The other question I had was on the water pills. Is that due to the medicine also?
The water pill,
Taking a water pill, then you have it on there. Is that due to the medication that you would need a water pill?
What do you?
I thought it was on the bottom, something to do with the water.
There are a couple on there, like
Diuretic,
hyperthyroid.
pills.
Yeah,
It's one of the medicines that helps to lower.
yeah, it makes you pee out the blood
It just
pressure
makes it-
basically.
Oh, if you,
All right, well,
I did have a quick question. Okay, once mine is stable, I've got a pressure coming home. The doctor didn't say I needed to, but if I heard right, you should check it if you're on medication for blood pressure.
Mhm.
You should take it every day.
Yeah, at least once a day.
Wow.
Yeah.
And the doctor didn't say it.
Yeah, some doctors
Yeah.
don't say that, you know, sometimes you get caught up in
We
the
get it
clinic.
checked every couple months, you
Yeah,
know, and they check it every month here. Sometimes I come if I'm here anyway.
it can be-
Like, I hadn't been doing it every day. I mean,
yeah,
that up a place in Andy.
once you're stable, it's a little less
But
important.
if I have to rest for half. Read, no, it's just planning.
like Dr. Wisniewski said, if it's been stable for a considerable period of time, a lot of times a physician or healthcare practitioner will say you can back off, you know. But,
aren't there signs though? I mean, that your body tells you that your blood pressure is going up higher?
Oh,
If
yeah.
you're not on medication?
Sometimes,
Yeah,
yeah, so high blood pressure is a long-term chronic condition, so some people have it for a very long time and don't know until something happens. And then sometimes there are people where their blood pressure will go real high in a minute, and then they might start getting chest pain or headache, blurry vision kind of stuff. But those are more acute, and even then, most of those people have actually had high blood pressure for a long time. And they just had something that, you know, flipped a switch.
I know I had a friend that was like at 140 when he got it checked. And that was just her normal
Mhm.
everyday occurrence, you know, I mean, it
Yeah.
wasn't
can-
that she was having any symptoms or
Right.
having any issues. That was just her normal blood
Right.
pressure.
140 over 90 used, if I remember right, used to be, I mean, 80 treated.
Oh, yeah, we would treat that today.
They
I was
changed
gonna
it.
say, they changed the
Changed the
numbers, just like cholesterol numbers and everything
Yeah.
else, they decided.
Yeah, the more.
I wonder if they want to sell nets.
Yeah, that does play into some of the guidelines, of course, but then there is also research that does show that the high blood pressure is very risky. You know, it increases the risk of heart attack, stroke, other issues with like the aorta. So I mean, yes, there is definitely money playing into it, it plays into everything, but there's also a real side to it as well.
So what is the high blood pressure